will just make the National Party feel happier and stronger and make them look better. And then they'll pass a lot of laws I don't like. I think this is purely a tactical issue. But the thing boils down, again, to a democratic one. If it increases their momentum and they get encouraged and they can then reach a majority, who am I to deny that majority? And really, I think this is just another version of the attitude change. Cost, however, in this modern world, is something we do get a problem with, because people will argue for knock-on effects. Oh, well, the euthanasia might be good, but unfortunately it's also a lot cheaper. So maybe what happens is that once we start finding we've got cheap euthanasia, we won't bother providing good palliative care. Could happen. I'm quite willing to accept that could happen. Again, I don't think the only way to resist that is not to change in the first place. I think there are other mechanisms we have available. What's interesting is that the evidence we do have doesn't necessarily suggest this happens. We can make a simple case which would say, well, hang on, if at the moment when I provide end-of-life care, I've got to produce it for 100 people and I've only got certain resources, maybe if a couple of those people who didn't really want the end-of-life care, they just wanted the end-of-life, weren't there, proportionally the remainder could actually get a better service. In practice, that's probably not going to be a big impact because the number of people who request euthanasia is tiny anyway, even in the countries where it's legal. But what is interesting is that in Holland, where euthanasia has been available for some time, we've actually seen a marked increase in the emphasis and the drive towards providing good palliative care. So if anything, it seems to have raised people's consciousness generally about end-of-life care, and it's had quite the opposite effect. Any slippery slope has been to increase the amount of palliative care in parallel with the availability of euthanasia. And certainly in New Zealand, when we did our own studies on euthanasia, illegal euthanasia in New Zealand, whether or not practitioners had access to palliative care services made no difference whatever to whether they were willing to perform euthanasia. One thing, however, that does come up, and I think, again, concerns a lot of people, and for plausible reasons, is the worry that, well, once we introduce it for some groups, might we then have to argue for consistency? So, for example, if I say I'm going to provide euthanasia for any of you guys who want it because you're competent, intelligent adults, why am I then discriminating against the people with dementia, the people who are psychotic, people with mental handicaps, children? All these people we're saying maybe it shouldn't be available for. It's unfair to them, we argue, because it's discriminatory and I am providing for a selected group. I'm not persuaded by this, and I'm not persuaded by it because I think quoting this or suggesting this is a problem is itself logically flawed. And it's logically flawed purely because if there is any reason to distinguish these two groups, then we can draw a logical reason. If the two scenarios are equivalent, if people who are psychotic, people with dementia are just the same as competent adults, then we don't have a problem. The point is they are not. And we're not discriminating. What we are saying is, in effect, that yes, this is available to anyone who can find a way of making their case competently, coherently, showing this is not a result of delusion, pressure, whatever. In practice, yes, that will mean it's not available to some people. But it's only not available as long as the mechanism is not there. And it's a bit really like saying, well, we'd be discriminatory if we banned access to some resources. To go down the sports field, we would not provide everyone with access to the pole vault area. Because if I stick a pole in your hand and tell you to run down an area without any training, you're going to injure yourself. If people cannot find themselves in a position where they can meet the requirements, then yes, we can look at ways in which we might be able to provide those requirements. And in some cases, that may take a long time. But the two cases are not equivalent in that we are not seeing people who are able to make a competent decision. The decision is available to all in principle. In practice, the difficulty is how to get people in a position where they can, if at all, make that decision. Of course, things like advanced directives, living wills, and so on have been suggested in that context. Okay, just a couple of other very quick things. Yes, we do get unexpected outcomes. People don't always draft laws very well, and we can get a slippery slope in a sense when this happens. I have to say there's a sort of fantasy I have. I like sharing my fantasies. And one of my fantasies is finding a country in the world where whenever a law was passed, it had a limited life expectancy. So we pass a new law, it will only last for 3 years, 5 years, something like that. And if there is no motivation to continue it, it will lapse. And I think that would put a lot of pressure on us to make sure we checked that our laws were working okay and to tidy them up at frequent intervals. This sort of thing does certainly happen. To go back to the UK's Abortion Act, it was really quite sweet because when they first passed it, that whole requirement that abortion should be made available if continuing the pregnancy constituted a greater risk to physical or mental health, in effect covered every pregnancy. Because at the time, continued pregnancy was actually statistically more dangerous than early abortion. So under those requirements, although the intention was not to produce an abortion on demand, in effect, it could do so. And although the line was never actually used, that was subsequently tidied up in the 1990 revision to the Act. And it seems to me quite reasonable that if we pass an Act and it leads to unexpected outcomes, then A, that's a lesson to be more careful in drafting the Act in the first place, and B, a timely reminder that we shouldn't just pass laws and then leave them there. We should monitor how well they're working and tweak them and adjust them as necessary. I think the big problem with this line of argument, though, is that if we use this kind of argument, well, by definition, we'd never change anything. Because, of course, any new law could have an unexpected outcome. What kind of expected outcome? Well, we don't know because it's unexpected by definition. And if we were never to pass a law because it might have an unexpected outcome, we would never have change, which I'm sure the very, very strongly conservative elements in our society might like. But for those of us who feel that society could perhaps do with a bit of improving, I'm not really willing to buy into that kind of line of approach. So, got the closing thoughts. Is it necessarily bad if we do have a slippery slope? I think my view on this is coloured by several things. One is that I don't still see how we know which way down the slope something's going to go. The usual suggestion is we will fall down a slope towards saying, once you start providing euthanasia for people who are terminally ill, then other groups will get included and people will get pressured to opt for euthanasia and so on. But of course one might say, well, maybe what we're doing is once you pass a law like this, you get people talking about end-of-life care more, people will get more interest in end-of-life care, they will start providing for better end-of-life care facilities for other groups as well, and indeed, this is what seems to be what we've seen in Holland. So in fact, the slippery slope, far from leading us to terrible consequences, might actually lead to improved outcomes in some contexts. This change might be totally coincidental, but at least it challenges the notion that a slippery slope must always be in a bad direction. So it's really rather difficult to show when these things do occur, because just the fact that A follows B does not mean that B caused A. But I think most importantly is this notion that slippery slope arguments very often just boil down to the fact that, well, they will change our views about things. Now, frankly, I think a lot of my attitudes could do with changing. And a lot of our attitudes, generally, are based upon half-formed notions, lack of real experience, stereotypes that have been put out by Hollywood or whatever. And in fact, what we may find is that when we try something, it turns out to be actually not as bad as we expected. And because it turns out to be not as bad as we expected, we get a bit more willing to consider other changes. This does not seem to me to be a bad thing. If we're concerned that others will change while we remain the same, well, yes, there's a certain rationality in terms of self-interest on that. But really, I think it wouldn't be a bad idea to sit there and think we need to check why we are being so unwilling to change ourselves when the rest of the world seems to be finding that things weren't so bad. And I'm afraid even if we still believe we're right and 98% of people are wrong, there's a certain level at which